Hi, greetings from a very snowy ASH meeting here in Atlanta. I am very glad to be here to tell you about some of our really interesting results that we're presenting at this meeting. We are presenting results of a phase 2 trial looking at a novel FLT3 inhibitor for the treatment of younger patients with AML with FLT3 mutant disease. Now, as we all know, midostaurin was recently approved in the United States to be added to chemotherapy for the treatment of patients with FLT3 mutant AML in the younger age category, 18 to 60. We are looking at whether a more potent, highly selective next generation FLT3 inhibitor could replace midostaurin potentially in that setting. This study lays the groundwork for that. In fact, what we're doing today is presenting the first results of 29 patients between the ages of 18 and 60 years old treated with this crenolanib compound plus 7 and 3 in a similar setting to what was done initially on the RATIFY trial. Now, this FLT3 inhibitor was added very similarly to standard induction, consolidation, and up to 12 months of maintenance in patients with both FLT3 ITD and TKD mutant AML. Many of these patients had very, very high white blood cell counts. Many of them had co-mutations such as DMNT3A, which are associated with very poor prognosis in this subgroup. The drug was extremely well tolerated. It has a half-life about 6 to 8 hours. The PK demonstrated good activity after 24 hours. There really were no significant treatment adverse events. And what was the outcome? The clinical data, that's what everyone always cares about. We had a 76% complete remission, incomplete count recovery after one cycle. After 2 cycles, the overall CR/CRI rate was 86% in our 20-something patients. Again, very small numbers, but when we took a look at the depth of the remission, over 90% of patients had FLT3 negative disease at the time of their first induction remission analysis, and over 90% of patients, 15 out of 16 patients where we had minimal residual disease data by flow, were negative at the same time point. So that suggests that we're getting very good response. We had clearance of patients with multiple mutations associated with resistance to other FLT3 inhibitors. And then when we looked at the overall response rates, with about 17.6 months of follow-up, 76% of our patients are still alive at that time point, and the cumulative rate of relapse in those patients is only 16%. Both of those numbers comparing very nicely and very favorably, a very small data set, with the numbers achieved in the original RATIFY trial. So we are enthusiastic about our data. We think that this is a compound that has significant activity in combination with standard therapy for those younger patients, and we're looking forward to launching a phase 3 trial comparing crenolanib with midostaurin in that patient population in a randomized setting to determine what the true efficacy and relapse-free results are going to be for those patients, and which could be the FLT3 inhibitor for the future.